Right now, as you're watching this video, your legs and feet may already be sending urgent warning signals about your heart, and most people completely ignore them. More than 6 million adults in the United States are living with heart failure, and many of them had symptoms for months, even years, before they were diagnosed. Not chest pain, not dramatic collapse, but subtle changes in their legs and feet that were brushed off as just aging, bad circulation, or being on your feet too long. And here's the truly shocking part. Medical studies now show that over 90% of people miss these early warning signs because they don't realize the heart often speaks first through the lower body. Swollen ankles, cold feet, weak legs, nighttime leg discomfort. These are not random problems. They are directly connected to how well or how poorly your heart is pumping blood through your body. In today's video, I'm going to show you 12 leg and foot symptoms that can appear early in heart failure, all backed by medical research. Recognizing them early can literally mean the difference between a manageable condition and a medical emergency. And please stay until the end, because symptom number 9 happens at night, affects most heart failure patients, and almost no one realizes it has anything to do with the heart. Before we begin, let me ask you something. If you're watching right now and this topic feels important to you, type 1 in the comments. If not, type 0. Your response helps this video reach others who may desperately need this information. Now let's begin. Symptom number 1, persistent cold feet. Let's start with something many people joke about, cold feet. Most people assume it's just poor circulation, cold weather, or that they need thicker socks. But in heart failure, cold feet can be one of the earliest warning signs. Here's why. When your heart begins to weaken, it can no longer pump enough blood to meet your body's needs. So your body goes into survival mode. Blood is redirected to your most vital organs, your brain, your lungs, your kidneys, and your heart itself. And your feet? They drop to the bottom of the priority list. A major study published in the journal Circulation found that patients with reduced cardiac output frequently reported cold extremities, especially the feet, as one of their first noticeable symptoms. Because your feet are the farthest point from your heart, they suffer first when circulation declines. What makes heart-related cold feet different from normal cold feet is this. They don't warm up easily, even with warm socks, even in a warm room, even after walking around. Patients often describe their feet as feeling constantly cold or numb, even when the rest of their body feels comfortable. If your feet are almost always cold, regardless of temperature or activity, it may be a sign your heart is struggling to keep up. Symptom number 2, pitting edema, the finger test. This next sign is something you can actually check right now. It's called pitting edema, and doctors use this test every day. If your ankles or lower legs are swollen, press your finger firmly into the skin for about 10 seconds. Then release. If you see a dent that stays there for several seconds instead of bouncing right back, that's pitting edema. And that kind of swelling tells a very specific story about your heart. Research published in the American Heart Journal shows a strong link between pitting edema and right-sided heart failure. Here's what's happening. The right side of your heart is responsible for pumping blood back to your lungs so it can get oxygen. When it weakens, blood starts backing up in your veins. Pressure builds, and that pressure forces fluid out of your blood vessels and into the surrounding tissues, especially in the lower body, where gravity pulls fluid downward. That's why the swelling usually shows up first in the ankles and lower legs. And when the tissue is filled with fluid, pressing on, it leaves a visible dent. That dent is not harmless. It's a sign your circulation system is under strain. Occasional mild swelling after a long day can happen to anyone. But persistent swelling with pitting is a serious red flag that should never be ignored. Symptom number 3, sudden leg weakness. This one often surprises people. Sudden or worsening weakness in your legs is not just about getting older. Research published in Circulation, Heart Failure revealed that people with heart failure experience real structural changes in their leg muscles. This isn't just feeling tired. When your heart can't pump enough oxygen-rich blood, your leg muscles begin to lose the proteins they need to contract properly. In simple terms, the muscles physically weaken from lack of nourishment. Patients in the study showed lower levels of myosin proteins, which are essential for muscle movement. That leads to difficulty climbing stairs. legs feeling heavy or shaky, getting tired after short walks, feeling like your legs give out. What's especially concerning is that this muscle weakness can continue even after heart treatments begin, because the muscle tissue itself has already changed. So if activities that used to feel easy now make your legs feel like rubber, your body may be signaling that your heart isn't delivering enough oxygen and nutrients to your muscles. Symptom number 4, rapid weight gain from fluid. This symptom often gets blamed on food, but it has nothing to do with fat. If you step on the scale and notice you've gained 5, 7, even 10 pounds in just a few days, and at the same time your legs and ankles look more swollen, this is not weight gain from eating. This is fluid retention. When your heart can't circulate blood properly, your kidneys receive less blood flow. And when that happens, your body activates hormone systems that tell it to hold on to salt and water instead of releasing it. So fluid begins building up inside your tissues. The Mayo Clinic lists rapid weight gain from fluid as one of the most urgent warning signs of worsening heart failure. And here's how you can often tell it's fluid and not fat. Your shoes suddenly feel tight. Your socks leave deep marks on your ankles. Your calves feel heavy and tight. Your weight jumps quickly instead of slowly over weeks. Because of gravity, most of this fluid settles in the lower body, legs, ankles, and feet. Some people report gaining 10 to 15 pounds in a single week, and every ounce of that is trapped fluid, not body fat. If this happens together with swelling in your legs, it is not something to watch and wait. It's a sign that your heart is losing the ability to manage circulation and fluid balance. Symptom number 5, bluish or dusky color in legs or feet. Now let's talk about color changes. Have you ever looked down at your feet or lower legs and noticed a bluish, purplish, or grayish tint? This is called cyanosis, and it happens when your tissues are not getting enough oxygen. A major review published in ESC Heart Failure identified peripheral cyanosis as a key visible sign of poor circulation in heart failure patients. Here's what's happening. When oxygen-poor blood starts pooling in your lower extremities, the skin begins to change color. Gravity again plays a role, pulling blood downward where your weakened heart struggles to move it back upward. At first, the discoloration may only appear when you sit or stand for long periods, but as heart failure progresses, the bluish tint can remain even when you're lying down. This is not cosmetic. It means your tissues are being starved of oxygen, and oxygen is what every cell in your body needs to survive and repair itself. If your toes, feet, or lower legs consistently look darker, bluish, or dusky compared to the rest of your body, it is a strong signal that circulation is compromised. Symptom number 6, persistent ankle swelling. That doesn't go away. Ankle swelling is one of the most common and most ignored warning signs. Many people think, I've just been on my feet too long, or it's just part of getting older. But heart-related swelling behaves differently. When your heart weakens, blood backs up in the veins, pressure increases, and fluid leaks into surrounding tissues. The Journal of the American College of Cardiology reports that ankle swelling is not only an early symptom of heart failure, but also a strong predictor of disease progression. Here's what makes heart-related ankle swelling different. It happens daily. It gets worse as the day goes on. Elevating your legs only helps a little. It keeps returning day after day. You may wake up with ankles that look almost normal, but by evening they're tight, swollen, and uncomfortable. And if pressing on the swelling leaves an indentation, that confirms fluid buildup, not just mild puffiness. This kind of swelling is your body showing you that blood is not flowing back to the heart efficiently. It's not just a leg problem, it's a heart problem showing up in your legs. Symptom number 7, slow healing cuts or sores on legs and feet. This is one of the most overlooked warning signs. You get a small cut, scrape, or sore on your leg or foot. Normally, it should improve within a few days, maybe a week. But instead, it just stays there. Sometimes for weeks. Sometimes even longer. A major study published in JAMA showed that people with reduced heart function often experience delayed wound healing in the lower extremities, directly linked to poor circulation and reduced oxygen delivery. Healing requires 3 things: oxygen, nutrients, immune cells. All of those are carried by your blood. When your heart can't pump efficiently, those healing tools simply don't reach your feet and legs in the amounts your body needs. So even tiny injuries struggle to repair themselves. This doesn't just mean slower healing. It also means higher risk of infection and tissue breakdown. If you notice that wounds on your legs or feet are taking much longer than usual to improve, it can be a sign that circulation is not keeping up with your body's needs. And that brings us directly to the next symptom. Symptom number 8, leg pain or cramping. When walking. Have you ever started walking, felt fine at first, and then your calves or thighs begin to ache, cramp, or burn? So you stop, rest for a moment, and the pain eases. Then you start walking again, and the pain comes back. This pattern is known as claudication, and it is strongly linked to reduced blood flow to the muscles. Research published in the Journal of Cardiac Failure shows that people with weakened heart function often cannot increase blood flow enough to meet muscle demands during activity. Your leg muscles are large and very active. They need a lot of oxygen when you move. If your heart cannot deliver that oxygen fast enough, the muscles begin to protest. At first, this may only happen during longer walks or climbing stairs, but as circulation becomes more limited, even short walks around the house can trigger discomfort. People often describe tightness, cramping, deep aching, sudden leg fatigue. This is not just a muscle issue. It is a circulation issue that reflects how well your heart is supporting your activity. If walking becomes harder because of leg discomfort that improves with rest, it's an important signal that your circulation may be under strain. Symptom number 9, restless legs at night. This one surprises many people. You finally lie down to sleep, but your legs feel uncomfortable. There may be twitching, crawling sensations, tingling, an urge to keep moving your legs. This is commonly called restless legs, and in people with heart failure, it is extremely common. A review in Sleep Medicine Reviews found that nighttime leg discomfort is frequently linked to fluid shifting and nerve irritation in people with reduced heart function. Here's why this happens. During the day, gravity pulls fluid into your legs and feet. When you lie down at night, that fluid redistributes back toward your core circulation. As that fluid shifts, it can compress nerves, alter electrolyte balance, increase pressure inside tissues. All of that can trigger uncomfortable nerve sensations in the legs. At the same time, if your circulation has already been reduced during the day, your nerves may be more sensitive to these shifts. So, what feels like a simple sleep issue may actually reflect circulation changes tied to heart function. And poor sleep then adds fatigue, weakness, and reduced energy the next day, creating a cycle that becomes harder to break. If restless legs appear together with swelling, cold feet, or walking discomfort, it may be more than just a sleep problem. Symptom number 10, worsening or new varicose veins. If you've had mild varicose veins for years and suddenly they start getting worse, or new ones begin appearing quickly, this can be more than a vein issue. A study published in Vascular Medicine found that reduced heart function can increase pressure throughout the entire venous system. When blood does not move forward efficiently, it begins to push backward in the veins. That extra pressure strains the valves inside your leg veins and the tiny gates that are supposed to keep blood moving upward toward the heart. When those valves weaken, blood starts pooling in the legs. That's when veins become larger, more twisted, and more visible. People often notice veins becoming darker, new bulges appearing, more aching or heaviness in the legs. When this happens quickly or together with swelling and fatigue, it may reflect rising pressure from reduced circulation, rather than just surface vein changes. Symptom: Charges 11, shiny, thin, or tight-looking skin on legs. Now let's talk about changes in the skin itself. Have you noticed that the skin on your lower legs or feet looks shinier than usual, tightly stretched, thinner, or more fragile? Research published in Heart and Lung describes these changes as common in people with long-standing fluid retention. When fluid builds up under the skin day after day, it stretches the tissue. That stretching smooths out normal skin texture and creates a shiny surface. Over time, the skin can also become more delicate, easier to bruise, slower to heal. This isn't just a cosmetic change. It reflects ongoing pressure inside the tissues from fluid that is not being moved out efficiently. When skin begins changing in texture along with swelling, it shows that circulation problems have been present for some time. Symptom number 12, persistent numbness or tingling in feet. Many people assume numb feet are just part of aging. But when numbness or tingling becomes frequent, constant, or starts interfering with balance, it deserves attention. A review in current heart failure reports explains that nerve symptoms in heart failure can develop through two main pathways. First, swelling can physically compress small nerves, reducing sensation. Second, reduced oxygen delivery can impair nerve function directly. Nerves are extremely sensitive to oxygen supply. When circulation declines, nerves may begin sending distorted signals, which feel like tingling, burning, pins and needles, reduced sensation. At first, this may come and go, but as circulation remains strained, symptoms can become more consistent. And reduced sensation increases fall risk because you can't feel pressure, temperature, or uneven surfaces as clearly. When numbness appears together with swelling, cold feet, or color changes, it may reflect circulation issues rather than just nerve aging. What it means when several signs appear together. Any one of these signs alone can have many causes, but when several appear together, especially over a short period of time, they may reflect changes in how well your heart is supporting circulation. Your legs and feet are often the first places where circulation problems become visible because they are farthest from the heart. Gravity pulls fluid downward. Muscles there require large oxygen supply during activity that makes them natural early messengers when circulation becomes strained. If you recognize several of these signs in yourself, ongoing swelling, cold or discolored feet, weakness while walking, slow healing sores, nighttime leg discomfort, numbness or tingling, I strongly recommend discussing these changes with your healthcare provider. Early evaluation allows simple tests to check circulation and heart function. When circulation problems are identified early, many supportive options can help reduce strain on the heart and improve blood flow to the legs. Waiting until symptoms become severe makes improvement much harder. Listening early gives you more choices and better long-term outcomes. Your body communicates constantly, and very often, it starts with small, quiet changes, especially in the legs and feet. Paying attention doesn't mean panic, it means awareness. And awareness gives you the opportunity to act before problems grow. If this video helped you notice something important, consider sharing it with someone you care about. And if you'd like more simple, science-based guidance for staying active and independent as you age, you're always welcome here.